Hey there, and welcome to our video on the best supplements for menopause. In this comprehensive guide, we'll be diving into the world of menopause and exploring the most effective supplements to help alleviate symptoms and support overall health during this transformative period. We'll cover key topics such as probiotics for gut health, vitamin D and calcium for bone density, magnesium for sleep and mood, and phytoestrogens like soy isoflavones and red clover for managing hot flushes. We'll also discuss the potential benefits and risks of popular herbal supplements like black cohosh and St. John's wort. By the end of this video, you'll have a clear understanding of the best evidence-based supplement options for navigating menopause with ease. So let's get started. Menopause is a natural transition that typically occurs in women between the ages of 45 and 55. During this time, hormonal changes can lead to various symptoms such as hot flushes, night sweats, mood swings, sleep disturbances, and bone density loss. While hormone replacement therapy is the most effective treatment for menopausal symptoms, some women prefer non-hormonal approaches, including dietary changes and supplements. Common symptoms experienced by women during menopause include sudden feelings of heat, often accompanied by sweating and flushing of the skin, irritability, anxiety, depression, difficulty falling asleep or staying asleep, thinning and drying of the vaginal tissues, which can lead to pain during intercourse, and accelerated bone loss due to decreased estrogen levels, increasing the risk of osteoporosis. These symptoms can vary in severity and duration among women, with some experiencing mild discomfort while others may have more severe and disruptive symptoms. Hormonal changes during menopause can also impact overall health, increasing the risk of cardiovascular disease, cognitive decline, and other chronic conditions. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats is essential for promoting overall health during menopause. However, some women may benefit from additional nutritional support through dietary supplements to help alleviate menopausal symptoms and reduce the risk of chronic diseases. Before starting any new supplement regimen, it is crucial to consult a healthcare professional to discuss potential benefits, risks, and interactions with existing medications. Some supplements may not be suitable for women with certain health conditions or those taking specific medications. Let's start by discussing the importance of probiotics and gut health during menopause. The gut microbiome plays a crucial role in postmenopausal health, influencing symptoms such as hot flushes, mood changes, and sleep disturbances. A systematic review by Chen and colleagues published in the journal Nutrients in 2023 found that postmenopausal women with a less diverse gut microbiome were more likely to experience severe menopausal symptoms. The authors suggest that the decline in estrogen levels during menopause may contribute to alterations in the gut microbiome, which in turn can exacerbate menopausal symptoms. Probiotics are live microorganisms that, when consumed in adequate amounts, can provide health benefits by promoting a balanced gut microbiome. A randomized, double-blind, placebo-controlled study by Sathiapalan and colleagues published in the journal Nutrition, Metabolism and Cardiovascular Diseases in 2021 found that supplementation with a specific probiotic strain, Lactobacillus plantarum DR7, for 12 weeks significantly reduced hot flushes, improved sleep quality, and enhanced overall quality of life in postmenopausal women compared to a placebo group. The authors suggest that the probiotic may help modulate the gut microbiome and reduce inflammation, which could contribute to its beneficial effects on menopausal symptoms. However, more research is needed to confirm the effectiveness of probiotics for managing menopausal symptoms and to identify the specific strains and dosages that may be most beneficial. Next, let's talk about the importance of vitamin D and calcium for maintaining bone health during menopause. Vitamin D deficiency is common among postmenopausal women, with prevalence rates ranging from 30 to 90%, depending on the population and geographical location. Low vitamin D levels can contribute to various health issues, including an increased risk of osteoporosis and fractures, cardiovascular disease, cognitive decline and dementia, and mood disorders such as depression. Adequate vitamin D intake, either through diet, sunlight exposure, or supplementation, is crucial for maintaining optimal health during menopause. The recommended daily intake of vitamin D for women aged 51 to 70 years is 600 to 800 IU 15-20 milligrams, while the recommended daily intake of calcium is 1200 milligrams. However, some studies suggest that higher doses of vitamin D may be necessary to achieve optimal blood levels and support bone health in postmenopausal women. A meta-analysis by Kwang and colleagues, published in the journal Food and Function in 2020, found that the combination of vitamin K2 and vitamin D3 supplementation was more effective in improving bone mineral density and reducing fracture risk in postmenopausal women compared to vitamin D3 alone. The authors suggest that vitamin K2 may enhance the beneficial effects of vitamin D3 on bone health by promoting the activation of osteocalcin, a protein essential for bone mineralization. It is important to note that excessive intake of vitamin D and calcium can lead to adverse effects, such as kidney stones and gastrointestinal issues. Therefore, it is essential to consult a healthcare professional to determine the appropriate dosage based on individual needs and health status. Moving on to magnesium, this essential mineral is involved in numerous bodily functions, including bone health, energy production, and muscle and nerve function. During menopause, magnesium supplementation may help alleviate certain symptoms and support overall health. Magnesium supplements, particularly magnesium glycinate, have been studied for their potential benefits in managing menopausal symptoms. A double-blind, placebo-controlled clinical trial by Abbasi and colleagues, published in the Journal of Research in Medical Sciences in 2012, found that magnesium supplementation, 250 mg magnesium oxide twice daily, for 8 weeks, significantly improved insomnia symptoms in elderly participants compared to a placebo group. The authors suggest that magnesium may help regulate neurotransmitters involved in sleep, such as gamma-aminobutyric acid, GABA. Another study by Kawai and colleagues, published in the journal Neuropsychopharmacology in 2015, investigated the effects of the amino acid glycine on sleep quality and found that glycine supplementation improved subjective sleep quality and reduced fatigue in individuals with mild sleep complaints. As magnesium glycinate contains both magnesium and glycine, it may provide additional benefits for sleep quality and stress reduction in menopausal women. Magnesium also plays a crucial role in bone health by regulating calcium metabolism and supporting bone mineralization. Low magnesium levels have been associated with an increased risk of osteoporosis and fractures in postmenopausal women. A systematic review and meta-analysis by Veronice and colleagues, published in the journal Nutrients in 2017, found that higher dietary magnesium intake was associated with a 27% lower risk of osteoporosis in postmenopausal women compared to those with lower intakes. The authors suggest that magnesium may help maintain bone density by reducing inflammation and oxidative stress, which can contribute to bone loss. When choosing a magnesium supplement, it is important to consider the form of magnesium as well as the dosage. Magnesium glycinate and magnesium citrate are two well-absorbed forms of magnesium that are less likely to cause gastrointestinal side effects compared to other forms, such as magnesium oxide. The recommended daily allowance, RDA, for magnesium is 320 mg for women aged 31 and older. However, individual needs may vary depending on factors such as diet, health status, and medications. It is essential to consult a healthcare professional to determine the appropriate form and dosage of magnesium supplementation. Now let's discuss phytoestrogens, which are plant-derived compounds that have a similar structure to estrogen and can bind to estrogen receptors in the body, exerting weak estrogenic effects. Some women may turn to phytoestrogens as a natural alternative to hormone replacement therapy for managing menopausal symptoms. Phytoestrogens are classified into several main categories, including isoflavones, lignans, and comestans. Isoflavones, found primarily in soybeans and soy products, are the most well-studied phytoestrogens in relation to menopausal health. Soy isoflavones are the most common dietary source of phytoestrogens, with high concentrations found in soybeans, tofu, tempeh, and soy milk. Red clover, Trifolium pratense, is another rich source of isoflavones, particularly biochanin A and 4-mononitin, which are converted to genistein and didzine in the body. Flaxseed is a rich source of lignans, another type of phytoestrogen that has been studied for its potential health benefits in menopausal women. Lignans are converted by gut bacteria into enterolactone and enterodiol, which can exert weak oestrogenic effects in the body. While some studies have suggested that phytoestrogens may help alleviate menopausal symptoms, such as hot flushes and vaginal dryness, the evidence is mixed. A systematic review and meta-analysis by Chen and colleagues published in the journal Nutrients in 2019 found that soy isoflavone supplementation significantly reduced the frequency and severity of hot flushes in menopausal women compared to placebo. However, the authors noted that the quality of evidence was low to moderate due to heterogeneity among studies and potential bias. Another systematic review and meta-analysis by Gazanfarpour and colleagues, published in the Avicenna Journal of Phytomedicine in 2015, investigated the effects of red clover on menopausal symptoms and found that red clover supplementation significantly reduced hot flush frequency and severity compared to placebo. However, the authors cautioned that the included studies had limitations, such as small sample sizes and short duration, and that more research is needed to confirm the long-term efficacy and safety of red clover for menopausal symptoms. Regarding flaxseed, a systematic review and meta-analysis by Lambert and colleagues published in the American Journal of Clinical Nutrition in 2017 found mixed results on its effectiveness for menopausal symptoms. While some studies reported improvements in hot flushes and other symptoms, others found no significant benefits compared to placebo. The authors concluded that more high-quality, long-term studies are needed to determine the efficacy and safety of flaxseed for menopausal health. It is important to note that phytoestrogens may not be suitable for all women, particularly those with a history of estrogen-sensitive cancers, such as breast cancer. Additionally, some studies have raised concerns about the potential long-term effects of high-dose phytoestrogen supplementation on endometrial and breast tissue. Therefore, it is essential to consult a healthcare professional before starting any phytoestrogen supplement regimen to discuss potential benefits and risks based on individual health status and medical history. Black cohosh, Actaea racemosa, is a perennial herb native to North America that has been traditionally used for centuries to manage menopausal symptoms. The root and rhizome of the plant contain several compounds, including tritopene glycosides and phenolic acids, which are believed to be responsible for its potential therapeutic effects. Black cohosh has been used in traditional herbal medicine to treat a variety of women's health issues, including menstrual irregularities, premenstrual syndrome, and menopausal symptoms. Its popularity as a natural remedy for menopausal symptoms has grown in recent years, particularly among women seeking alternatives to hormone replacement therapy. Despite its widespread use, the evidence on the effectiveness of black cohosh for reducing hot flushes and other menopausal symptoms is inconsistent. A Cochrane systematic review by Leach and Moore, published in 2012, evaluated the efficacy and safety of black cohosh for menopausal symptoms. The authors included 16 randomized controlled trials involving 2,027 perimenopausal or postmenopausal women. The review found insufficient evidence to support the use of black cohosh for menopausal symptoms, with most studies reporting no significant differences between black cohosh and placebo in reducing hot flushes or improving other symptoms. However, some individual studies have reported positive effects of black cohosh on menopausal symptoms. For example, a randomized, double-blind, placebo-controlled trial by Shahnazi and colleagues, published in the Iranian Journal of Nursing and Midwifery Research in 2013, found that a standardized black cohosh extract, 6.5 mg daily for 8 weeks, significantly reduced the frequency and severity of hot flushes in postmenopausal women compared to placebo. The inconsistencies in the evidence may be due to variations in the quality and composition of black cohosh preparations, as well as differences in study design and population characteristics. More high-quality, well-controlled studies are needed to determine the efficacy and optimal dosage of black cohosh for menopausal symptoms. While black cohosh is generally considered safe when used in recommended doses for short periods, up to 6 months, it may cause side effects in some individuals, such as gastrointestinal upset, headache, and dizziness. Rare cases of liver damage have been reported in association with black cohosh use, although a causal relationship has not been established. Black cohosh may also interact with certain medications, such as hormone replacement therapy, birth control pills, and blood pressure medications. Therefore, it is essential to consult a healthcare professional before using black cohosh, particularly for individuals with pre-existing health conditions or those taking medications. St. John's wort, Hypericum perforatum, is a flowering plant that has been used for centuries in traditional medicine to treat a variety of conditions, including depression, anxiety, and sleep disorders. In recent years, it has gained attention for its potential benefits in alleviating menopausal symptoms, particularly depression and hot flushes. A randomized, double-blind, placebo-controlled study by Abdali and colleagues published in the journal Menopause in 2019 investigated the effects of St. John's wort on menopausal symptoms and found that St. John's wort supplementation, 900 mg daily for 8 weeks, significantly reduced the severity, frequency, and duration of hot flushes compared to placebo. The authors suggest that the antidepressant and serotonin-modulating effects of St. John's wort may contribute to its beneficial effects on menopausal symptoms. However, it is important to note that St. John's wort can interact with numerous medications, including antidepressants, birth control pills, blood thinners, and certain cancer treatments. These interactions can lead to reduced effectiveness of the medications or increased risk of side effects. Therefore, it is crucial to consult a healthcare professional before using St. John's wort, especially if you are taking any prescription medications. In conclusion, while certain supplements may provide relief from menopausal symptoms, it is crucial to approach their use with caution and under the guidance of a healthcare professional. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats remains the foundation for promoting overall health during menopause. Regular exercise, stress management techniques, and maintaining a healthy sleep routine are also essential lifestyle factors that can help alleviate menopausal symptoms and improve quality of life. The most promising supplements for managing menopausal symptoms include probiotics for maintaining gut health, vitamin D and calcium for bone health, magnesium for sleep and bone density, and phytoestrogens like soy isoflavones and red clover for reducing hot flushes. However, the evidence regarding the effectiveness and safety of these supplements is mixed, and more high-quality research is needed to confirm their benefits. Black cohosh and St. John's wort have also shown potential for alleviating menopausal symptoms, but their efficacy and safety require further investigation. Ultimately, the decision to use supplements for menopause should be made in collaboration with a healthcare provider who can assess individual needs, health status, and potential risks. By combining a nutrient-dense diet, regular physical activity, stress reduction techniques, and carefully selected supplements when appropriate, women can navigate the menopausal transition with greater ease and maintain optimal health during this transformative stage of life. Thank you for watching this comprehensive guide on the best supplements for menopause. We hope you found the information helpful and informative. For more resources and to purchase high-quality supplements, visit nutritionmarket.com.au, where we have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to discuss your individual needs and develop a personalized plan for managing menopausal symptoms. Remember to hit the like button and subscribe to our channel for more evidence-based nutrition and health content. And as always, please keep in mind that while this information is based on scientific research, it should not replace advice from your healthcare provider. Some findings may still be under investigation, and it's essential to consult with a qualified professional for personalized recommendations. Thanks again for watching, and we'll see you next time.